This video is brought to you by Straight Goods News, Canada's alternative online news source. Visit straightgoods.ca.
Let's now turn to the fourth chapter in our report. It deals with Health Canada's role in regulating pharmaceutical drugs for use in Canada. Canadians rely on Health Canada to ensure the safety and effectiveness of drugs, and Health Canada has taken steps to ensure the quality of those reviews. However, we found that the department is struggling with timeliness and transparency in some areas. In addition, it has not determined what measures are needed to address the potential for conflicts of interest in its reviews of drug submissions. Health Canada is slow to act on potential safety issues related to drugs already on the market. It needs to get safety information out to Canadians more quickly and address the potential for conflicts of interest. In closing, I would like to share with you some reflections based on the many years I have spent as an auditor of the federal government. In my experience, the government requires certain fundamental elements. Government programs require certain fundamental elements to be successful. These elements include clarity of purpose, committed and sustained leadership, predictable and stable funding, and sufficient and appropriate information for management. Most of the problems found by our audits over the years can be attributed to weaknesses in one or more of these key areas. I encourage the government, as it undertakes its current review of spending, to ensure that these core elements are in place to secure the success of continuing programs. This concludes my opening statement. I'm now ready to answer your questions. Je suis prêt maintenant à répondre à vos questions.
Thank you. We'll start with Julie Van Dusen from the CBC.
Yes, Mr. Wiersema, what do you make of the fact then that billions of dollars were spent on a job creation plan and it doesn't seem to be evident how many jobs were created?
That observation that we made in our report refers to one of the Economic Action Plan programs, the Community Adjustment Fund. This particular program had a specific objective to maintain or create jobs in regions hard hit by the economic downturn. Given that the government had established this as an objective for that particular program, I believe it was a $2 billion program, we think it should have had the mechanisms in place to be able to collect data on the actual jobs maintained or created. It didn't do so for this particular program. Nevertheless, though, my overall message here, we spent the Economic Action Plan involved $47 billion of stimulus to the economy. I think it's really important that the government follow through on its commitment to report to Parliament on the overall success of the Economic Action Plan, both in stimulating the economy and in creating employment in early 2002.
But how hard can it be to count jobs?
It can be very hard to count jobs because there are different questions, issues. Was the job going to happen anyway? What about part-time jobs? And therefore, my understanding is, with respect to the overall report on the Economic Action Plan, the government will be using various economic modeling techniques to report on the success of the program. But as you've indicated, for this particular program, they said they had an objective of creating or maintaining jobs. Given that objective, we think they should have had a mechanism in place to actually to measure how it did.
Roger Smith, CTV News.
Yes, sir. On the drug testing and health and safety, can you characterize how serious these delays were? I mean, were these creating life-threatening risks for Canadians?
I think overall it's important to remember that, to point out that the audit concluded that the Health Canada does a good job in reviewing its submissions, so that when it approves a drug for use in Canada, Canadians can have confidence that it's safe and effective. The problem is that the department's consistently not able to meet its timelines for those reviews of those drug submissions. It's established its own service standards. It's not able to meet those timelines. The other important question is the question of following up on safety issues that are brought to its attention. It becomes aware of safety issues with drugs from various sources. It receives thousands and thousands of those reports. The department is slow to act on those safety issues. In some cases, it can take actually up to 2 years to review the safety issue and to communicate the results to Canadians. And we think that's too long.
Well, but, you know, how serious a risk is it? Is it a life-threatening situation in some cases? You mentioned in particular on page 26 of that chapter, a safety assessment of a drug approved to treat epilepsy and migraines, which could have caused other problems like birth defects. Can you tell us about that drug? And generally, my follow-up was, tell us what that drug was. And the follow-up is, I want to know how serious these the risks were that were created by these delays.
Unfortunately, I can't tell you specifically what that drug is. I can have one of my staff follow up with you on that. I think it's important that that the Health Canada have mechanisms to prioritize these safety issues, to determine which ones are most important to investigate, and for those that pose a significant risk to Canadians, to get that information out to Canadians as quickly as possible. I think, though, what's critically important here, $47 billion of investment into an economic stimulus fund. I think the government owes it to Parliament and to Canadians to give us a clear and comprehensive report on how the plan did in stimulating the economy and how the plan did in maintaining and creating employment.
Do you have the tools to measure the impact on employment in particular?
As I understand it, the government intends to use economic modeling tools to report to Canadians on the impact on employment. We haven't yet seen that report, so we haven't looked at it, obviously, because it doesn't exist yet at this point, but it's something that I think we'll be monitoring quite carefully.
Terry Malewski, CBC.
First, a general question, if I may, and that is, it's a theme in your conclusions that, like previous Auditor General's reports, you portray you paint a picture of the federal bureaucracy as a kind of giant stumbling around in the dark, doesn't know what it's doing. You say poor information is chronic and widespread, your words. It's not encouraging. It sounds like very little progress has been made in this respect from previous times, notwithstanding the explosion of information technology, which ought to be able to give managers good information. And then I also have a specific question by way of a follow-up to these ones about job creation, and that is whether we can rely, given that the program is, you say on page 22 of Chapter 1, program design did not allow for assessment of the key objective, job creation. Well, that's what the program was for. They didn't design it to actually measure whether it achieved its object. And you said, well, job creation can be hard to measure in your answer to Julie's question. So what I'm driving at there is, well, can we rely on these macro models that you say they're dedicated to without actually asking how many jobs did each project create?
Well, let me deal with the second part of your question first. And as you correctly pointed out, one of the Economic Action Plan programs has an objective to create or maintain jobs. Given that you established that objective, then we think the government should have been tracking its performance there. Whether or not we can rely on what the government does in reporting on the Economic Action Plan, well, we haven't seen the government's report yet. I haven't audited the models that it will use. It's something we can consider for audit at a future point. But there are, I think, rigorous models out there that could provide Canadians with a good report. I'm not sure which ones the government intends to use. With respect to the first part of your question, Terry, about the question of management information in government, yes, I do believe that this is a widespread and chronic problem in the government. I believe that the government is perhaps too dependent on one-size-fits-all approaches or direction from the center as to what types of management information it needs. The Government of Canada is in a very complex, highly diverse business. What's going to work for HRSDC isn't going to work for DND. So what I encourage the government to do is to ensure or to expect that the managers delivering a government program have good information on their program. What's the objectives of the program? What results are we achieving? What are the service levels that are being provided with the program? How much does the program cost? Up-to-date and reliable information on costs. I'm encouraging that the government ensure that that's in place with respect to the programs that come out the other end of the strategic review that's currently underway.
Joanna Smith, Toronto Star.
Hi. Many of these concerns have been raised by, speaking of the Health Canada chapter, raised by drug safety advocates for years, in particular the post-market approvals for, fast-track drugs and stuff. I noticed Health Canada said that they would, they agree with all of the recommendations, taken steps to implement. What makes you confident they're actually going to do all of this work?
I believe that the department is in the process of preparing detailed action plans in response to our recommendations. And from my discussions with senior officials in the department, I have a lot of confidence that we have their attention. They're engaged, and I'm looking forward to a possible parliamentary committee hearing on this chapter where the department gets to present its action plans, and the office will monitor its progress with interest, and hopefully parliamentary committees will ask the department to report on its success on implementing its corrective actions.
Has the Commons or Senate Health Committees been in touch with you about taking such a step?
Not yet at this point. We only tabled the report an hour and a half ago. So, or perhaps the Public Accounts Committee would have a hearing on this chapter as well.
Shirley Engel, Global.
Good morning. Just wanted to follow up on Roger Smith's question. I know you don't want to discuss specific examples, or perhaps you have some others, but a lot of Canadians watching this about the Health Canada concerns specifically will wonder how alarmed should they be? I mean, in many cases, we're finding out from other countries first some of these concerns, and is there any justification for a 2-year wait to report on what could be very serious safety concerns? I mean, I'm just wondering how alarmed Canadians should be.
Well, we think it's a serious issue, which is why we've included in our report. I think 2 years is too long. What's the cause of the problem? I think if you ask the department, I shouldn't speak for the department, but I think it'll fundamentally be a question of resources. The department has implemented a new cost recovery regime, and so now with additional resources should be in a position to respond to these potential safety issues more quickly. 2 years is a long time. Shouldn't take so long.
You talk about the spending review, I guess, specifically with Health Canada, but more broadly, I'm just wondering, as Interim Auditor General, how concerned you are that the current spending review might impact a lot of the issues you're looking at in this report, given that it might affect the resources available, to address some of the larger issues you've found in bureaucracy in general.
Well, that's a bit hypothetical at this point because I don't know what the government is going to decide in its current strategic and operating review. But I would encourage the government for those programs that it continues to maintain coming out the other end of the strategic and operating review, that those programs have clear objectives, clearly defined roles and responsibilities, good management information, and predictable and stable funding, so the public servants are in a position to be able to manage the programs well and strategically over the long term.
Yes, could you tell, is your office going to be doing a full audit of the overall economic action plan once the government puts in its report next year?
At this time, we don't have any plans to do another audit on the economic action plan. That's something we will continue to monitor and adjust our plans as necessary going forward.
So does that mean that Canadians may never really know just how successful the largest stimulus program in Canadian history was?
I sure hope not. As I've indicated, I think it's really important that Canadians know how successful this was. The government's committed to providing that report to Parliament in early 2012, and I encourage them to follow through on that commitment.